Community Assessment for the Town of Abington, Massachusetts by Tarita Mitchell. The purpose of this presentation is to perform a community assessment of the overall town of Abington, Massachusetts, to analyze community needs, population size, and mortality rates as it relates to two major illnesses that affect its aggregates, and to discuss health resources and interventions that can mitigate illness. A community is a compilation of people, homes, governmental bodies, and various organizations. Within a community exists a sense of fellowship among people who share similar interests, attitudes, and goals. Abington, Massachusetts earned its title from Governor Joseph Dudley of the Massachusetts Bay Colony in 1706 and was incorporated in 1712. Abington was originally part of the Bridgewater Purchase made on March 23, 1650, from Massasoit, chief of the Wampanoag Federation. Abington is currently the 125th largest community by population in the Commonwealth and ranks 75th by population density. It is Massachusetts' 8th congressional district. Abington is a suburb of Massachusetts located in Plymouth County. According to the United States Census, as of April 2010, Abington, Mass. Has a population of 15,985 people. Currently, it has risen to 16,275. It has 9.9 square miles. 9.7 of those square miles is land, and 0.3 square miles is water. 91.9% of the population is Caucasian. 13.3% of the population is over the age of 65. 33.9% of the population has a bachelor's degree. Median household income between 2013 to 2017 was $39,503. However, 3.6% of the residents live below the poverty level. Minority individuals that live in the area may be at a disadvantage to accessing health care and obtaining health insurance coverage. Abington is a city comprised of mostly single-family homes. There are apartment buildings located within the area. Family-owned farms are located within residential neighborhoods, and oftentimes they sell fresh produce. Abington Housing Authority provides low-income housing for those who are socioeconomically challenged. Housing needs for the aggregate seem to be sufficient, however, homelessness is an issue. On the South Shore, there are currently 78 homeless shelters, some of which are located in Abington. There are various churches in and around the Abington area that address the religious needs of the community, from Roman Catholic to Evangelical Lutheran. Schools addressing educational needs ranging from preschool up to high school are prominent in the area. Massachusetts College and Fisher College are on the outskirts of Abington, located in Brockton, Massachusetts. Transportation is private, for most residents own and utilize cars for mobility. Massachusetts Transit does provide bus routes for those individuals who do not drive, and ride sharing is also an option. Addressing disease and health issues is important to the health of the community. Cancer and heart disease are the leading cause of death in Abington. Smoking also represents another major health issue among young adults. In Massachusetts, youth use of tobacco rose from 13.3% in 2003 to 17.6% in 2009 and was higher than the current cigarette use in history. The causes of these health issues may be attributed to a sedentary lifestyle, indulgence in fast foods, smoking, lack or limited access to health care, drug and alcohol use, multiple comorbidities, and uncontrolled pre-existing conditions. As of 2013, cancer was the leading cause of death in Plymouth County. Total cancer deaths of all types in Abington, Massachusetts was 22.90%. As of 2017, 12,934 individuals in Massachusetts have died of cancer. Heart disease is also a major illness that affects the Abington area. The crude rate of death per 100,000 as a result of heart disease reached a rate of 157.2 in Plymouth County between the years of 2011 to 2013. As of 2016, Abington has a premature mortality rate of 250 to 275 per 100,000 people. As of 2017, 12,140 individuals have died of heart disease. Smoking is a factor that can predispose residents in Abington to cancer and heart disease. It also causes respiratory ailments, birth defects, and is an irritant to eyes, nose, and throat. Although state laws prohibit selling to minors, access by youth of tobacco and tobacco products is still a major health problem. South Shore Hospital is the leading hospital in the area. It offers extensive medical care services including trauma care. Health Express, which offers comprehensive medical services on a walk-in basis, is also located in Abington. Urgent Care is located in the adjacent town, which offers greater access for individuals with challenging schedules. Abington Dental offers a wide range of dental services for residents. The nursing home within the area is Colony Center for Health and Rehabilitation, which offers medical services for the elderly and disabled. Health determinants are factors that affect outcomes of health status, such as environment, behaviors, and individual health. Healthy People 2020 is an initiative that strives to mitigate health disparities and improve health in all groups. One important goal is to increase the length of life free of preventable diseases. Heart disease is a preventable disease. Interventions for the community would include: heart disease is among the nation's leading causes of death and disability in the U.S., costing an estimated $351 billion in 2003. Steps to prevention that I would include involve instituting policies on a state and national level to bring public awareness and knowledge of the disease, as well as educating aggregates of each community that hold higher risks for heart disease. Enhance and promote cardiovascular health through interventions across all age groups, placing the emphasis on an active lifestyle with unlimited indulgence in fast foods, alcohol, and drug use, and controlling existing disease processes like diabetes. Focus on health disparities of groups that are disenfranchised. Ensure accessibility and affordability to quality health services that can impact lives. Address issues that have to do with bias and mitigate any barriers to health care. Perform ethical and evidence-based research on environmental, socioeconomic, cultural, and genetic factors that might predispose individuals to heart disease. Utilize policy and procedures to perform effective monitoring of patient status in order to establish preventative treatments. Uncover and address clients' existing comorbidities that can be a precursor to heart disease, such as diabetes and hypercholesteremia. Communicate issues of importance of the need to abstain from drug, alcohol, and tobacco use. Encourage an active lifestyle with exercise being part of a daily routine. Educate the community on the importance of a healthy diet, limiting the use of sugar and trans fats. Abington is a progressive and safe community. However, it has health issues that need to be systematically addressed before the health of its aggregates begin to decline. The public health nurse can be instrumental in assessing and educating the health care needs to combat health problems such as cancer and heart disease, while advocating for those who are disenfranchised and have limited access to health care services.